Hi, I'm George Leconte, Senior Associate Executive Director of New York City Health and Hospitals, Elmhurst.
And I'm Helen Arteaga-Landaverde, the CEO of New York City Health and Hospital, Elmhurst.
I am a former president of New York Regional NAHSE and also a current member, and we're going to talk a little bit about Elmhurst Hospital.
Good morning.
Good morning. How are you doing?
Very good.
Well, first let's start off. Tell us a little bit about Elmhurst Hospital.
Okay, so Elmhurst Hospital, it's a unique place. We are in the heart of Queens. We actually, in our hospital walls, we speak about 123 different languages, which represent anywhere from 93 to 98 different cultures and religions. So not only are we in the heart of Queens, but we're also served the most diverse borough that there is in New York City and in the nation.
Fantastic. So, as a New York Regional member myself, and also an Elmhurst Hospital alumni, Elmhurst Hospital employee, one of the things I love about this place is the diversity that exists here. And New York Regional was really founded, or I should say National Association of Health Services, was really founded to really look at the underserved population. Okay, the underserved population in terms of health care. So how does Elmhurst serve in that capacity?
So I think one of the things that makes Elmhurst unique, because we're in the most diverse communities in Queens and in New York City, I think naturally it becomes part of how we serve others. I think the way we service medicine, the way we do our surgery, the way we do our patient education, all of that's a little different because we try to be very culturally sensitive. For example, when I was a patient here, and when you're in a lot of pain, you originally go back to your native language. So right away, even though they knew I was bilingual, but because I put my preference in speaking Spanish, the nurses and the doctors always started with like, would you like us to speak in Spanish first? And I think that's very different from other places that go straight to English first. And I like to think that here at Elmhurst, we try to always be that extra sensitive and trying to speak your native language, whether it's some African dialect, some Middle Eastern dialect, everything from Chinese dialect, even to French and Creole, because even within French and Creole, there's different dialects. So I think that makes us really unique. And I know we do that because on an annual basis, we use over 1.5 million minutes in the translation line.
That's a lot of minutes.
Yes, that's a lot of minutes. So I know we're actively doing that, and I think that's what makes us unique. But I think the other factor that how we service the community is in our type of outreach. Everything we do outside our walls is also very culturally sensitive. We try to celebrate most of the holidays, like Lunar New Year. We try to celebrate the different cultures that we serve in each of our communities. We definitely love to celebrate, so definitely that's a good thing. But I also think one of the most important things is that Elmhurst Hospital is, while we're a level 1 trauma center and a tertiary hospital, we do a lot of cool stuff in here. We do a lot of really cool stuff at a local level. Everything from working with our local high schools to make sure Black and Latino young students get interested in healthcare. I think that's important. I think the fact that we do community work with our local churches and our local temples, I think that's important because we're part of the fabric of the daily lives of our community. And, you know, and it's so true because I live in Corona, and the fact that I'm a girl from the neighborhood who was a patient and now the patient became its CEO, I think is huge. And I also think it's a huge step forward because I'm also the first woman of color to be its CEO in its 100-year history. So I think that's important. But I also think that's important in the sense that we're looking at diversity. We're looking at our community. We want our leaders to look like our communities and our doctors. So I think that makes this like not just a regular hospital. It makes it feel like home.
Excellent. And that itself is one of the partnership that really makes NAHSE and Health and Hospitals Elmhurst such a great system, because we share the same concept. We really want to provide care to all of our patients, regardless of who you are, what you look like, where you come from, what your religious background is. We want to make sure that there's access to health to everyone. And that's one of the key things that New York Regional has been fighting for years and years and years. And National Association of Health Services Executive have been a leader in terms of fighting for the health care of the underserved. So,
No, and I think that's what makes your organization so great, and that's why you've been around so long.
yes.
And I think that's huge, and I think that's why people are committed to your organization on a volunteer basis, because you guys don't even get paid.
No.
So I think the fact that you have such a huge impact is a big thing. It's a huge testament to your organization and why we partner so well.
Well, thank you.
Yeah.
So I want to thank you, Helen. Is there anything else you'd like to say to our NAHSE members?
I think the most important, continue doing the amazing work that you're doing. Do not give up. I know they've been very hard days. COVID was not easy on our community, wasn't easy on us, wasn't easy on with each other. But there's light at the end of the tunnel. So one, get vaccinated, super important, to keep the numbers down. And two, don't give up. Our community needs us, and and as long as we show up for them, there's still hope. So thank you.
Thank you, Helen. Have a great day.